But there's a really big difference between what's common and what's normal, and that's what we've forgotten. It's not actually normal for human beings to have chronic disease. That's one of the, if this is the only thing that people listening to this come away with, that's what I would like it to be. It's not normal.
What is up, my friend, and welcome to the Legendary Life podcast. I'm health expert Ted Rice, coach to entrepreneurs, executives, and other high-performing professionals. And what we do here at Legendary Life is break down science-based information on how to lose fat, prevent disease, and live a long, healthy, legendary life. So if that's what you're into, you are in the right place. Click that subscribe button wherever you listen to podcasts so that every time one of my episodes goes live, you'll be the first to know. Let's move on to the episode.
Chris Kresser, welcome to the Legendary Life podcast.
Oh, I'm so happy to be here. Thank you so much for having me. It's a pleasure.
Me too. I've been looking forward to this for a long time. You've been on my interview wish list for a while, so it's finally happening. Chris, you've got a new book out, Unconventional Medicine, and I've talked a little bit about you in the intro that I did for this interview, but I just love to hear your explanation of this unconventional medicine that you talk about, otherwise known as functional medicine or integrative medicine. Can you explain what that is?
Yeah, it's a new approach, or not new, it's actually ancient, but in its modern form, it might strike some people as new, that is really focused on addressing the root cause of the problem instead of just suppressing symptoms. So an analogy I like to use is if you have a rock in your shoe and it's making your foot hurt, if you go into the conventional medical system, you'll get a diagnosis of foot pain. Or actually, it'll probably be a fancier term that makes it sound more medical and official. And then you'll get a prescription for a painkiller. And certainly that'll help reduce the pain. But I think we can all agree that it would be better to just, take off your shoe and dump out the rock. And that's really what functional medicine is all about. It's about first finding what that rock is in the case of a chronic health issue, and then, taking the shoe off and dumping it out. And that leads to longer lasting and better results. And it leads to avoiding unnecessary drugs and surgery. And that's really what we need to do at this point.
Yeah. And as you mentioned in the book, we're in the middle of a crisis where chronic disease is costing us hundreds of billions of dollars.
Trillions, actually.
Trillions of dollars. So, and people are arguing about healthcare, and there's something to be said about that. But the reality is, even if the government pays for everyone's healthcare, we're still going to go bankrupt unless something changes. I want to get into that first, but you have a really interesting story for those of you listening who've never heard Chris's story. Chris, could you talk about how you came up on functional medicine? Why did you try this alternative version instead of what most people do when they go to the doctor, to a conventional medicine practitioner?
Well, I did what most people did at first. It just didn't work. So I was traveling in Asia and I got really sick. I came home and, went to conventional doctors, and they all meant well and they all did their best to help. So I don't blame any of the individual doctors that I saw, but it became clear very quickly to me that conventional medicine just wasn't set up to deal with the kind of problem that I was facing. It does very, very well with acute trauma, emergency, injury type of situations. If I get hit by a bus, I definitely want to be taken to the hospital. But in a situation like I was in, where I had, this mysterious, chronic, complex health condition that, nobody could really figure out and didn't fit into one of those categories, I just wasn't finding any answers or relief. So over time, I, changed my diet and lifestyle. That was, of course, a big part of my recovery, but then also learned about functional medicine and this concept of trying to identify the root cause of a problem and address that rather than just putting Band-Aids on it. And that made a lot of sense to me. So it was natural for me to kind of pursue that, and it worked. It really helped me to recover my health. And then I became so passionate about it, I decided to go back to school and study it, and help others who were dealing with similar situation. And that's how I came to this work, as is the case for a lot of people in the healthcare profession. I would struggle with my own health challenge and wanted to share what I had learned with other people who are in the same boat.
Yeah, I hear that. And that's what got me into this business as well. I'm more on the health and fitness side, a health coach, fitness coach.
Mm-hmm.
And I don't deal with the situations that you deal with. I know you help people with all types of issues, but I know everybody can relate listening to you, because most of our listeners, they're late 30s, 40s, 50s and up. And I've heard from them personally on their experiences with allopathic medicine practitioners, your primary care physicians, in other words. And we're in this situation where doctors maybe don't have the time to do the research to figure out what's going on and try to approach it differently than just giving some drugs. Could we talk about that situation?
Yeah, sure. I think the way you put it is right. It's not a problem with individual doctors, although of course, there are always some bad apples in any bunch, and that's true in any profession. But overall, most of the doctors I've met are caring, kind individuals that really want to help and went into medicine for the right reason. It's a systemic problem that we're facing, and there are a number of reasons for the system that we have. Some of the ones that are better understood are, conflicts of interest. So, for example, what's in the interest of a pharmaceutical company is to sell more drugs, and that may or may not be in the best interest of patients and practitioners. Often it's not. We also have insurance companies. The interest of the insurance company is not always in alignment with the doctor or the patient. And so there are a number of, deeply entrenched financial interests that are invested in maintaining the system that we have. But I would actually argue that the bigger problem is just we have the wrong paradigm for addressing chronic disease. And as I mentioned, our medical paradigm was really more appropriate for acute problems. And that's because it evolved during a time when acute problems were the biggest issues that we faced. Back in 1900, top 3 causes of death were all acute infectious disease: typhoid, tuberculosis, pneumonia. Other reasons that people would go to the doctor at that time were also acute in nature, like a broken bone or a gallbladder attack or an appendicitis. And the treatment was pretty simple. It was, you put the bone in a cast, or you take out the gallbladder or the appendix, or later you give an antibiotic for the infection and you're done. It was pretty straightforward. But chronic diseases are a whole different ballgame. They're complex, they're difficult to manage, they usually last for a lifetime, and they don't lend themselves to that one, problem, one treatment, one doctor kind of approach. They usually require multiple doctors. In fact, we have different doctor for every different body part at this point.
Right.
And they're complex and difficult to manage, as I said. So if you imagine someone who is suffering from multiple chronic conditions, they're taking multiple medications, and then they show up to the doctor's office with a new complaint that the doctor is not even aware of, it's impossible in a 10-minute visit, which is the average length of time that a primary care physician can spend with a patient these days, for them to do anything meaningful, in terms of figuring out what the underlying cause is, or, making nutritional recommendations or lifestyle recommendations. The only thing they're going to have time for in that 10-minute visit is to, listen to the patient's symptoms, make adjustments to their medications, possibly prescribe a new medication, and, say goodbye. That's the reality of the situation. And I know so many doctors who feel just as trapped, if not more trapped, in that model than the patients themselves do. They know that they're not serving patients the way they set out to when they decided to enter medicine, and they feel terrible about it. And in fact, this is leading many doctors to quit medicine. A recent survey suggested 50% of doctors have thought of quitting medicine. 70% think that medicine is heading in the wrong direction. 49% either often or always experience feelings of burnout. So the problems with our healthcare system don't just affect patients, they affect the doctors as well.
Yeah, so well said. And I work with a lot of doctors. I train a lot of doctors, and it's a tough situation. Chris, I'd love to talk a little bit about the problem that's the big elephant in the room that people think a workout will solve or a diet program or a diet book will solve. And that is our environment. And I know you're big in this, big into ancestral health.
Yeah.
And I think sometimes we don't realize that it's, you can follow a diet, you can follow an exercise program. I certainly do. Other people are fitness minded do, but you're really working against the grain. You're fighting an uphill battle. In fact, from the studies on blue zones, we know just moving to one of those blue zones, that's going to solve a lot of your problems. And living in a place like a city like I do here in Miami Beach or New York City or someplace like that, you're bombarded by light. You're surrounded by food everywhere, and most of it's processed, convenient food. And man, can you talk a little bit about like what the underlying problem is, this evolutionary mismatch that's going on between our genes and our environment?
Yeah. I mean, this is of course one of the premises of my book. And I think a lot of people don't actually see it this way, which is interesting. Chronic disease has become so common now. One in two Americans have it. 1 out of every 1 in 4 have multiple chronic diseases. So every one of us either has a chronic disease or knows somebody that does have one, right? Nobody is not affected by it. And so because of that, we've come to accept it as normal. We just think it's a normal part of being human. Just like if you go to the doctor and you say, hey, I'm starting to have, I'm 45, 50, I'm starting to have some memory problems. They just go, you're just getting older. It's just part of the deal. It's all seen as kind of normal. But there's a really big difference between what's common and what's normal. And that's what we've forgotten. It's not actually normal for human beings to have chronic disease. That's one of the, if this is the only thing that people listening to this come away with, that's what I would like it to be. It's not normal. And how do we know this? Because we have studied traditional hunter-gatherer populations that around the world in places like Bolivia and Paraguay and the South Pacific and Africa that, despite some contact with the West, industrialized world, have still managed to maintain their traditional diet and lifestyle. And what we see in those populations is that these folks are remarkably lean and fit, and they're virtually free of the chronic inflammatory diseases that plague us. They don't get diabetes, they don't get heart disease, at least not nearly at the rates that we do. They're not obese or overweight. They don't get Alzheimer's or Parkinson's or dementia. There's a stark contrast. And some people have said things that they've argued, hey, that they don't get those diseases in those places because they don't live long enough to acquire them. They all die when they're 30 or 40 years old. But that's actually not the case. It's true that people in those areas have shorter lifespans on average, but that's because they don't have access to emergency medical care. And some recent studies have found that when they do have access to even the most rudimentary form of medical care, like walking for half a day to a rural medical clinic, they live lifespans that are equivalent to our own, but they reach those ages without acquiring any of the chronic diseases that we get. And an example of that is a population called the Tsimane, and they're in Bolivia. And there was a series of articles in the New York Times earlier this year about them. And they have an incidence of heart disease that's 80% lower. 80% lower than that in the US. And 9 in 10 Tsimane adults between the ages of 40 to 94 have completely clean arteries. They did CT scans on these folks, which means they have no risk of heart disease at all, at least as we currently understand it. They also had virtually no dementia or Alzheimer's disease. So here we have this population that has very little access to modern medical care. They actually have much higher rates of infection than we do because they live in in a river basin. So they have parasites and all the other things you would expect a population that's living outdoors in close contact with a river to have. And yet still, they're incredibly healthy. So why is that? You already answered the question. It's that if we took those Tsimane people, it's not their genes. They have the same genes as we do. So if we took them and dropped them in Miami Beach, like you said, or New York City, they would develop the same health problems that we all suffer from. And that's because there's a mismatch between our genes and our biology and what our bodies are hardwired for and the modern diet and lifestyle that we're living today.
Yeah. And I forget the name of the tribe. I've been a couple of tribes, but there's a tribe in Mexico. I'm sure you're familiar with the studies where they live partially in Mexico and then they migrated to Texas, and the genes are absolutely the same, but the people who migrated just over the border who have a modernized lifestyle develop diabetes and all these other issues where, the ones who stay behind in Mexico don't.
That's the Pima.
The Pima, that's
Pima.
right.
Mm-hmm. Yes, absolutely. So that's proof right there that it's not just about the genes, it's about the environment and how the environment affects gene expression. And this is true not just for human beings, by the way, it's true for every other organism on the planet. If you think about like hydrothermal bacteria that live deep in the ocean, so deep where it's absolutely black, there's no light. It's one of the few organisms on the planet that can survive without light, because most other organisms require photosynthesis, at least, for plants on their own, or for people who eat plants or whatever, or people who eat, animals that eat plants, or, we all need light in some way. But these hydrothermal bacteria have adapted in this environment, these really extreme environments, so that they can survive on chemicals that would kill almost every other form of life. And that's an example of how the environment powerfully affects, evolution and what enables a particular organism to survive and thrive. And if you took that hydrothermal bacteria and you dropped it in a shallow ocean, it would die. It wouldn't make it. It's not that extreme for us. We're able to survive in a suboptimal environment, but our health certainly suffers as a result. We can't escape the fact that we are products of that evolutionary adaptation. Our bodies require certain nutrients, and both macronutrients and micronutrients to function properly. And we get that in our ancestral diet. Our ancestors ate mostly meat and fish, wild fruits and vegetables, nuts and seeds, and some starchy tubers, rich in all of the nutrients we need, naturally low in calories, plenty of fiber to feed the beneficial gut bacteria. But today, the top 6 foods that we eat as a percentage of calories are sugar-sweetened beverages like sodas and colas, alcohol, fried chicken dishes like chicken nuggets, bread, pizza, and grain-based desserts like cake and cookies. So those foods are nutrient poor, meaning they don't have the nutrients that we need. They're high in processed and refined sugars that create a toxic environment in our gut. They're inflammatory, and they're naturally high in calories. So it's literally the exact opposite in every way of our ancestral food environment. And that's why we are a nation of, 4 in 10 of us are obese now. And 1 in 3 of us have diabetes or prediabetes. It's a natural consequence of what you would expect to happen if you created, the kind of environment that we have.
Yeah. And I had Rob Wolf on not too long ago, and he was talking about the hyperpalatability of those foods you mentioned.
Yes.
So not only are they terrible for us, but we want more of them. In fact, I'd rather eat pizza than broccoli or kale or whatever other vegetable that I should be eating. And I'm curious, Chris, because I know you work with a lot of people.
Let me just jump in and say one thing about that, because it's something super important for people to understand. Because I think there's a perception that when we overeat or when we eat unhealthy foods, it's something wrong with us. There's something broken about me. I don't have enough willpower. I'm weak. I'm lazy. Whatever. That's just simply not true. The truth is that we are all acting out our evolutionary programming when we seek out those foods, because human beings evolved, and I'm sure Rob might have mentioned this, but human beings evolved in an environment of food scarcity. So the biggest problem we had for the vast majority of our history, even right up in some parts of the world, it still is that way, of course, but it all over the world for all of human history, food scarcity was a much bigger problem than food abundance. So our bodies are programmed in a way that would help us to survive in an environment of food scarcity. What does that mean? It means we seek out foods that are calorie dense. We seek out foods that are hyper palatable because it means that there might be more different kinds of nutrients. And same with variety. The higher variety of food we would eat in a natural environment, the more different types of nutrients we would get, because there wasn't pizza and cake and cookies. It was just different types of nutrient dense food. So we are genetically programmed to seek out rewarding, palatable, calorie dense foods, and the people who were most successful at doing that would have survived.
Right.
So we are the ancestors of people who successfully sought out all of those who had the most powerful mechanisms for seeking those foods out. So that's all well and good in an environment of food scarcity. But what happens when all of a sudden we find ourselves living in an environment of food abundance, where you have a 7-Eleven on every corner with 64-ounce Big Gulps and Twinkies and cheese doodles, and you've got Costco with mega sizes of everything, and you go out to a restaurant and they bring you a plate that's as big as the table. We do not have the genetic and biological machinery to resist that very well. On the contrary, we are programmed to go for it. And it's very difficult to override that programming with your conscious brain.
Absolutely. I mean, I've been in fitness for 18 years and professionally, and I've been doing this lifestyle for even longer, closer to 20. And I still have problems. And Chris, another thing that's important to mention, and I don't like to get too conspiratorial or anything like that, because I really believe it's up to us to manage our behaviors and to learn what's going on and to manage ourselves accordingly. But there's food scientists. I remember reading Fast Food Nation when it came out. There's food scientists off the New Jersey Turnpike trying to put things together in a way that will trigger these reward sensations in your brain, so reward pathways in your brain, and the advertising that we're bombarded with at all times. Can you speak a little bit about that? Are you aware of the research? How does that affect people with all those food advertisements?
I agree with you. I don't think it's a conspiracy. I just think it's a natural consequence of the market-based forces that we live, that we're subject to. We have big food companies that are public corporations that their mission is to sell more of their products. That's their job.
Got to make the numbers for Q3,
that's
right?
How they reward shareholders, and that's the way capitalism works. So it's not really a conspiracy. It's actually the natural result of the way that things are set up. And I'm not arguing that there's anything wrong with capitalism or that we should have a different system. I'm just pointing out that is the expected result of the system that we have. And problem with that is that everything that I just mentioned about food scarcity and food abundance and how we're hardwired, that's all science. That's all actually well established. And we're not the only folks who know about that. These food companies, they know about that science too. And not only that, they actually hire scientists who are experts in what's the homeostatic and hedonic systems of the brain that govern our food intake. There are people who study this and get PhDs in it. And they actually are experts in how to manipulate that system so that we will eat and eat and eat. Some of your listeners are probably old enough to remember the Pringles advertisement. I bet you can't eat just one, was their tagline for so long. And you know what? That was a bet they knew they would win because they engineered those chips so that you couldn't eat just one, because they trigger every single reward, they push all the right buttons so that you will keep eating even beyond the point that you're hungry. And, there's a little thought experiment that I often ask people to do that makes this clear. If you imagine 2 plates, and on one side you have a steamed white, steamed potato with no salt and no fat of any kind. It's just a russet potato and it's steamed. And then on the right, you've got, let's say, Pringles or any other, potato chips that you like on the plate. I think it's probably pretty clear to most people that you're only going to eat as much of the potato as it will take to satisfy your hunger. and probably not a single bite more because it's
Right.
not very palatable or rewarding. But most of us have had the experience of eating not only enough potato chips to satisfy our hunger, but many, many more than we needed just to satisfy our hunger, or ice cream or any other food like that. So that's the kind of food environment that we live in now. If we were just dropped into the Simane village, it would be probably hard for many of us to overeat because their diet is so simple and, just nutrient dense whole foods, not a lot of sugar or, added fat or other things that stimulate those reward mechanisms. So I think it's helpful to actually be aware of the forces that are working against us, not in a conspiratorial way, but just in the way that they're not supporting our efforts to health. Because if you become aware of that, then you can limit their influence over you. You don't keep those foods at home, for example. If you understand the concept of decision fatigue, which is a really important concept to understand, we only have a certain amount of mental energy to make decisions in a given day. And if you use up all of that energy at work, for example, making decisions or making other decisions, and you get home from work and you're tired, and then you open your cupboard and there's a bag of potato chips in there, the energy that you might have used in the morning to resist that is going to be gone, and you're going to go for the potato chips. And so a simple thing you can do to prevent that from happening is just not have those potato chips in the house in the first place, because you understand those concepts and you understand that those chips are actually, or the people who make those chips are not necessarily interested in your health. They're interested in you buying those chips and eating the entire bag. That's what works for them.
Yeah, so true. And, unfortunately, even though I interviewed an insider from the food industry, and she was telling me the companies actually make more money selling the produce and the meat, but people just are drawn to it naturally. And, they actually make less money off the processed food. But if they sell it in big enough bulk, which they do, they make more money on that. Chris, I want to jump into...
Well, it's also subsidized.
It's also subsidized. That's a great point.
That's another major thing that we need to be aware of. And this actually relates to medicine too. So, corn and soy and these commodity food products are subsidized. It makes it cheaper, for farmers to grow them, and they make more money when they sell them. And that actually encourages a certain kind of industrial food system that is, again, not in our best interest. In the same way, our conventional medicine is subsidized, so that if you go to the doctor and you have high cholesterol, the conversation that doesn't happen, but that could happen, is like this. Okay, you have high cholesterol. You have two options. You can change your diet and lifestyle, and that will bring down your cholesterol. But sorry, your insurance company is not going to pay for any of that. They're not going to pay for your gym membership. They're not going to pay for your healthier diet. They're not going to, pay for your coach or nutritionist who helps you to implement any of that. Or you can take this statin drug, and guess what? Good news, your insurance company is going to cover, nearly 100% of that. So that's the impact that subsidies have on medicine, is they actually powerfully influence the choices that both doctors and patients make, because they, for most people, money is a limited resource, and, that has to be part of the consideration. So it's important to keep that in mind when we talk about how to change healthcare.
Yeah. And, I don't, a lot of the PTs and chiros that I know are people who can either work for cash or bill insurance, choose not to go that route and not to mess around with insurance simply because it's such a hassle at the moment. Chris, I'm wondering, man, how do you live an ancestral lifestyle? You're based out of California, right? You live in a city. So how do you do that? How do you make it work?
Well, there's definitely some effort required, but I think once you get some of it set up, it's much easier just to go with the flow once you've created that. So, there are lots of steps we can take to mitigate the impacts of the industrial environment. One, the most important certainly is food. And so as I mentioned, we practice what we preach. We don't keep foods in the house that I wouldn't that I don't want to be eating or don't want my family to be eating. It doesn't mean we never have treats. It just means we don't keep those in the house, because 95% of the time we don't want to be eating that stuff. And if we ever do, it might be out at a restaurant or on a road trip or something like that. I'm pretty diligent about my sleep. I make sure to be in bed for at least 8 hours a night, sometimes 8.5. I don't necessarily sleep all of that time, but I'm pretty disciplined about giving myself that much time to be in bed. I have a daily meditation practice, which I've had for almost 30 years now, which really
before
helps
it was cool.
Yeah. And that's probably one of the most important steps I've ever, I take in terms of maintaining my health. I limit my exposure to artificial light at night. So I wear these glasses. They're not right here. They're similar to these, but they have amber tinted lenses that filter out the blue light that's emitted from screens that can suppress melatonin and interfere with sleep. And I just don't use a computer or a tablet within an hour or two of going to bed, typically, if I can avoid it. I make sure to spend time with my family and loved ones. I think that's actually not only essential for happiness, it's also essential for health. I mean, we are tribal creatures, human beings.
Right.
We evolved in a close-knit tribal social group setting, and most of the world, we still live that way. It's only in the industrialized world where we live in these kind of more isolated, single family social arrangements. So I think, and there's actually a study that showed that lack of social support is a greater predictor of early death than smoking 15 cigarettes a day.
Wow.
Which I think surprises a lot of people. It certainly surprised me when I read that.
I have not heard that, and that's surprising to hear in a way, but I definitely see how that could affect.
Right. Yeah, it makes sense. It's an area of mismatch. We are kind of programmed for that kind of social support and contact. And when we don't have it, it's not just our mental health that suffers, our physical health suffers. So in a way, if you follow what I'm saying, what I'm kind of doing is trying to mimic the ancestral environment in a way that's consistent, that's compatible with our modern life. I'm not arguing that we have to go to extremes like sleeping out in the backyard and, wearing a loincloth. You can be a normal person, live a normal life. But if you just take a few steps to mitigate the impact of the industrial lifestyle, those can go a long way.
Yeah. I actually had a guy, Dr. Ben House, a functional medicine guy, who did move to the jungles of Costa Rica just to live this way. For most of us, though, I don't necessarily see myself doing that as much as I long for the health benefits. But
it's not an option for for 99.9% of people anyhow.
So true. Yeah. And Chris, I want to get into your book because you're proposing a solution to this problem other than the solution that you just gave, this lifestyle, living more of an ancestral lifestyle, even in spite of your modern surroundings. The title of the book is Unconventional Medicine. Join the revolution to reinvent healthcare, reverse chronic disease, and create a practice you love. And in part, you're trying to get practitioners on board, people like me, health coaches, which, I can't wait. I really want to go through your ADAPT program. I think it would be awesome to learn from you. And for anyone listening who is a health practitioner, you got to check out chriskresser.com. You've got to read this book. But Chris, for the people who aren't in the health profession, which many of the listeners, they're attorneys, they're executives, they're people, they're accountants with their own business.
Yeah.
Why would they need to read this book?
Well, there are a few reasons. First is that if you don't, anyone in that group that you just mentioned is either dealing with a chronic disease themselves or has a family member or a friend that is, just by the nature of the statistics that we're talking about. Or if you're not yet dealing with a chronic disease, unfortunately, there's a pretty decent chance that you might be at some point in your life because of the statistics again. So the book is important for that group of people because as we started talking about in the beginning of the show, conventional medicine is not really set up to address chronic disease effectively. So if you find yourself in that group, or you have a son or a daughter or a sister or brother or a mother or father who's dealing with a chronic condition, you need to know what the best approach is. And that's what the book outlines in the form of functional medicine, an ancestral diet and lifestyle, and a collaborative practice model. So it's really kind of a primer for the general public about what healthcare should look like when it comes to chronic disease, and what the potential is if you have a chronic disease. You don't have to accept the idea that you just need to take medication for the rest of your life and there's nothing else that can be done, which is often the explanation that's given in the conventional system. There are things you can do, and you often, in many cases, can reverse the disease even after it started, or better yet, if you get a head start and you're healthy now, you can prevent the disease before it occurs, which is the best possible outcome. So that's number one. Number two is that even if you have no intention of entering healthcare, health and healthcare affects all of our lives on a daily basis. And I would argue that the people who are really going to lead this movement are not even not doctors and not even healthcare professionals in general. It's the general public. I can't tell you how many times I've trained, the doctors that I train. We ask them how they found out about me. The answer is, one of my patients brought in an article, printed out from your website, and I read it and I liked it, and I went and learned more, and I started following your work, and here I am. I mean, that happens all the time.
That's excellent.
We have mothers who have followed my work and have been able to address behavioral disorders like ADHD or even autism spectrum disorders in their kids just from the information that they've picked up from, reading these kinds of books. So everybody needs to be actively involved in their own health care and also in the care of people around them, because there's, none of us that are not affected by this.
Yeah, I would add to that. I feel like so many people, as I mentioned in the beginning as well, and we were talking about before, people are looking for I need to lose some pounds. What diet should I get? What workout program? And those are all great things, and we should be active. We should be focusing on our diet and the foods that we're eating. But by reading your book, I feel like it'll cause a shift in their paradigm to realize what is behind all this, all the things that we've been talking about in this podcast already. But when you sit there and you read a book and you digest the information and you think about it, and it takes you a couple hours or days or whatever to read, it's a profoundly different experience. And man, one of the reasons that I like you so much, Chris, and appreciate you is there are a lot of holistic health people out there, or people who say they do functional medicine, who are not really evidence-based. And we can argue about whether that's a good thing or not a good thing. For me, I don't always need a systematic review of randomized controlled trials to tell me something, like to use something or to experiment with something. But also there's a lot of people out there who are not, they don't know what they're talking about.
Yes. Yeah, no, it's true. And I think it is important to strive to be evidence-based in our, recommendations, whether it comes to diagnostic tests and procedures or treatments, because medicine is not a harmless thing. You can actually harm people if you don't do the right thing, and that we all, that's why one of the first thing, the principles of medicine is first do no harm. So it's really important to pay attention to the evidence base. I do want to address a common misconception, which is that conventional medicine is evidence-based and all other forms of medicine are not. We often hear this. The truth is, if there are a lot of aspects of conventional medicine that are definitely not evidence-based. So take the top-selling drug right now in terms of sales is Abilify. So Abilify is an antipsychotic, actually. It was only approved by the FDA for psychosis. And you might be scratching your head and wondering now, how is it possible that an antipsychotic is the number one selling drug in the US? We don't, arguably there are obviously some people with psychosis, but not enough to make Abilify the top selling drug. And The reason that it is because it's prescribed in an off-label way. So what that means is that physicians, part of their scope of practice allows them to prescribe a drug that was approved for one condition for other conditions, even though it was not approved by the FDA for those uses. They can also prescribe a drug for a population that a drug was never studied in. So for example, if a drug was approved in adults for a particular indication, they can prescribe it for kids, for that indication, even if it was never studied in kids. So that's what's happening with Abilify. You've got a massive amount of off-label prescriptions that are being made for Abilify in ways that it was never studied and shown to be effective by the FDA or shown to be safe. And yet here we are with Abilify being the number one selling drug in the US. So that's not evidence-based. That's not an evidence-based use of that medication at all. And there's so many other examples. We could go on, but it's a misnomer to say that conventional medicine is always evidence-based. By the same token, functional medicine, people say, there's no evidence for functional medicine. Well, that's kind of like saying, what's a good analogy? I'm struggling to find an analogy here, but it's functional medicine is a paradigm. It's an approach or a perspective. So you're not going to go into the scientific literature and find a study on functional medicine. It doesn't work that way. Functional medicine is a way of organizing our thinking. It's a way of looking at things. It's a way of approaching the body and approaching disease. So let me give you an example of how the evidence actually does support functional medicine. Take a condition like IBS, irritable bowel syndrome, very common. You can go into the research and find studies about Imodium and how it helps stop diarrhea. And you can find studies on, analgesic drugs and how they reduce pain for IBS. And you can find studies on laxatives and how they improve constipation. So you might think, these are the only evidence-based treatments for IBS. But if you understand that SIBO, for example, bacterial overgrowth in the small intestine can cause IBS, or disrupted gut microbiome can cause IBS, or other problems, then all of a sudden you start finding studies in the literature that support those connections. And those studies all support functional medicine, but they don't have the word functional medicine in the title of the study or anywhere in the study. So people say, it's misleading. You have to know where to look to find the evidence that supports functional medicine, but it's everywhere.
Yeah, no, well stated. And it's an approach, and there are a lot of studies on the specific treatment protocols that functional medicine practitioners use. It's just there's not a study called a review of functional medicine, right? And I think, it's always great to have that hard evidence, but sometimes the clinical picture is going to be different, and you're able to get results with a person that required some detective thinking on your part and some experimentation to get the results. Could you talk a little bit about maybe a situation like a high cholesterol or high blood pressure, something very common, that how you would use a functional medicine approach?
Yeah, those are really good examples because they're so prevalent. High cholesterol, as we said earlier, it's usually just take a statin and that's it. See you next time. But the truth is, there are actually a lot of things that can increase cholesterol that can be addressed. So one of those is poor thyroid function. And in fact, before statins or other cholesterol-lowering drugs were invented, doctors would often prescribe a low dose of thyroid hormone in order to bring cholesterol down. We know that a number of different gut issues can increase cholesterol levels. Helicobacter pylori, H. pylori infection, disrupted gut microbiome, intestinal permeability have all been shown to increase cholesterol levels. Insulin resistance and leptin resistance can increase LDL particle number, which is related to cholesterol. And so someone who has, diabetes or a metabolic problem could potentially have higher cholesterol as a result of that. We know that actually heavy metal toxicity, high levels of mercury or lead have been shown to increase cholesterol. So we look at all these different things that could potentially lead to high cholesterol, and we address those. And then, in a lot of cases, the cholesterol will just come back down and normalize on its own. If it doesn't, it will still often come down. It might not go all the way to normal, but then we can start tweaking the diet and using specific dietary interventions and even supplements to get that last bit of reduction that we're looking for. And rarely do we need to use drugs, but even if drugs were used, they would often be at a much lower dose than would typically be used otherwise. Very similar for blood pressure. High blood pressure is absolutely a lifestyle-driven condition. There's no question at all. You do not see high blood pressure in traditional populations, and it is very susceptible to, very much driven by diet behavior and lifestyle. Particularly stress is a huge factor, but certainly, processed and refined foods, deficiency of potassium and other nutrients can be a big driver. Lack of sleep, lack of physical activity is a huge driver, of course. And so it's uncommon for us to be able to make really significant progress with those kinds of conditions with the functional medicine approach, even without getting close to drugs.
Yeah. So it's not caused by a statin deficiency or a diuretic or,
No. I mean, that's how conventional medicine in a lot of ways, the way it approaches chronic disease is as a drug deficiency. So like you're saying, statin deficiency or blood pressure is a diuretic deficiency, depression is an antidepressant deficiency, and ADHD is a stimulant deficiency, and the list goes on and on.
Yeah. And Chris, if someone wanted to work with, I'm not sure if you take patients anymore, but if someone wanted to work with you or to work with someone whom you've trained in your ADAPT framework, where would they go to find that person?
Yeah, so I take a limited number of patients right now. I'm probably getting close to closing again, but California Center for Functional Medicine, my clinic has 5 clinicians now, so we can accommodate a much greater number of patients than when I first started, when it was just me. So California Center for Functional Medicine, and then Kresser Institute website, that's my training website. And the top right, there's a link that says find a provider. And we have almost 400 people that have gone through my training program or are at some, almost finished with it. Not all of them have completed all the necessary work to be listed in the directory, but quite a few have. So you can go there and put in your zip code and your address and search for a provider that I've trained there. And that's going to be growing and expanding, each year.
Excellent. And I think it's really important. Referrals are super important. And you're someone who I feel super comfortable referring people to or referring to your network, because we don't want anybody who is going to try chakra balancing to help someone's depression or cholesterol issues. That might be okay. Yeah. In a holistic approach, but let's try some actual, lifestyle supplementation, whatever it is that they need to get a change. Chris, it's been such a pleasure having you on the show. And what I love most about your book and your approach is like there's hope for people who feel stuck. Yeah. And they went to their doctor and it's like, 1 minute of maybe change your lifestyle or exercising more, but here's this prescription, and they walk away just feeling devastated and confused and not sure what to do. And you're giving people hope, and I respect you and appreciate you for that.
Oh, well, I appreciate that, Ted, and thank you for having me on the show and giving me a chance to talk about this movement to reinvent healthcare and end chronic disease. I think together we can make a huge impact. As Margaret Mead said, never doubt that a small group of committed citizens can change the world. Indeed, that's the only way it ever has. And I really believe that that's true. As individuals, we can't necessarily do much on our own, but if we come together as a group to push this forward, we can, there's no limit to what we can achieve.
Wow. Powerful words. Chris Kresser, thank you so much. For those of you listening, make sure you check out Unconventional Medicine by Chris Kresser. It's on Amazon.com. Go to KresserInstitute.com or ChrisKresser.com and learn more about what Chris is up to. He's definitely a person you want to pay attention to. Chris, thanks so much. I hope this is the first of many interviews, and can't wait until we do this again.
Yeah, me too. And keep up the great work. Appreciate your time.